Hello, my name is Siblin. I am a student at Seneca College. I'm in the BSN program. This is my head-to-toe assessment for BSN306. This is the room I will be performing my assessment in. This is the ceiling. These are the floors, and this is going to be my patient. He is going to be wearing a hat for religious reasons. As well, I'm recording on a tripod. So, before I enter my patient's room, I make sure to perform hand hygiene, in this case with hand sanitizer. And after sanitizing my hands, I'll make sure to clean the bell and diaphragm end of my stethoscope with an alcohol swab. And lastly, I'll make sure to don on a clean pair of gloves before entering my patient's room. I enter. Hi, my name is Siblin. I'll be your nurse today. Today we're just going to be doing a simple head-to-toe assessment. Do I have your consent for this procedure?
Yep.
Wonderful. Before we begin, do you mind if I just see your ID band?
Yep.
Perfect. Can I just get your full name and your date of birth?
My full name is Surya Nagarajan and my date of birth is March 31st, 1995.
Wonderful. Patient identity is confirmed. And before we begin, do you have any sort of pain, discomfort? Do you feel like you need to use the washroom?
No.
Wonderful. So I'll draw the curtains for patient privacy and begin my assessment. Now, upon initial inspection, I can see that my patient's, how old are you?
29.
So his stated age does match his physical appearance. His skin color matches his ethnic background. And he does appear to, and there is no noticeable odor. Now, can I just get you to stand up for me? Wonderful. I see that he's symmetrical. There are no obvious lesions or physical deformities. And that he is well nourished. And you can, if you could just walk back to the foot of the bed, and then walk back to me, and then you can walk back to your spot. From his gait tells me it is steady, he's balanced. And now, how are you feeling today?
Feeling well.
Perfect. So he's feeling well, he's pleasant, he's cooperative. I can tell from his face that he's not under any sort of distress or discomfort, and that he's dressed for this occasion. Feel free to grab a seat. Wonderful. And now I'm just going to test for his level of consciousness. What is your name?
Surya Nagarajan.
And where are you right now?
I'm at home.
Perfect. And what is today's date?
November 24th, 2024.
Wonderful. Because he gave me the place, time, and his name. I can say that he is alert and conscious at ×3, and that his speech is not slurred. Now we'll begin testing cranial nerves. Begin testing a cranial nerve, starting cranial nerve 7, the facial nerve. So can I just get you to smile, no teeth, and now smile with lots of teeth. Perfect. Now frown. Now scrunch your face up in grimace. Perfect. And puff your cheeks out. Wonderful. And if you could just close your eyes, I'm going to try and open them. I want you to resist. Wonderful. And I can see from this assessment that his face was also symmetrical, and tells me cranial nerve 7, the facial nerve, is intact. Moving on to cranial nerve number 3, the oculomotor nerve, we'll be doing the Perla assessment. So beginning with his pupil size, if you could look straight at me, I can see that his pupils are about 3 millimeters. They are round and equal. We'll be doing the direct and consensual light reflex test. All right, so I'm going to take the light. You can keep looking straight at me. I'm going to shine it in his right eye, and I can see that his right pupil constricts, which is direct, and then on the left side, direct, there's direct reflex intact. And now for consensual, I'll shine the light on the right eye, and the left pupil does constrict, and on the left eye, the right pupil does constrict. Wonderful. And now we'll test so direct and consensual reflexes are intact. And now for accommodation, I just need you to look right at the pen. So right now his pupils are dilated, and as the object approaches closer, just follow with your eyes. His eyes do converge and his pupils do contract, indicating accommodation is intact. So oculomotor 3 is functioning and intact. Moving on to his nose, I can see that it is midline. There are no flares. Can I just get you to cover one nostril and breathe in and out? Perfect. And on the other side, in and out. Perfect. Both nostrils are clear, indicating patency. Moving on to cranial nerve number 8, the whisper test. The acoustic nerve, we will be doing the whisper test. So I'll be covering the tragus of one ear. I'll whisper 3 two-syllable words. I just need you to repeat them back to me, all right?
Yeah.
Perfect.
today, party, soccer.
Perfect. And now on to the other side.
Patient, Monday, today.
Wonderful. Because you repeated accurately, cranial nerve 8, the acoustic nerve is intact. And now moving on to cranial nerves 9 and 10. 9 is glossopharyngeal, 10 is your vagus nerve. I'm going to get my tongue depressor and my pen light. Now I just need you to open your mouth, stick your tongue out. Perfect. We're going to press down. All I need you to do is say ah. Wonderful. I can see that there was a rise and fall of the soft palate and uvula, indicating cranial nerves 9 and 10 are intact. Perfect. And now we're going to move on to the assessment of your arms, okay? So if you could just put your arms down upon physical inspection, I see that there is no muscular atrophy. The skin does match his skin color does match his ethnic background. There are no obvious scars, lesions, bumps, lumps, or bruises. Now on palpation, I just need you to let me know if you feel any pain or discomfort, all right? Any pain or discomfort?
No.
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 Perfect. Once again, I'd like to highlight on inspection, my patient does have a tattoo on his left arm, but there is no pain or discomfort with that, correct?
No.
Wonderful. And now, upon palpation, I found that there was no obvious masses, no edema felt, and we're going to use we'll roll down the gloves and use the dorsal part of our hands to test for the temperature and diaphoresis of the skin. And I noticed that his skin is warm and dry. Perfect. We'll be testing his pulses, beginning with the radial pulse, testing bilaterally and simultaneously. The pulses are about 70 beats per minute. They are strong 2+, they're equal, and they are regular in rhythm. Moving on to his brachial pulse, again, testing bilaterally and simultaneously. At 70 beats per minute, they are equal, 2+ in strength, and regular in rhythm, which is excellent. Now, if you could just stand up, we'll be going through some range of motion exercises. So, if you could just hold your hands out, we'll go through wrist flexion and extension, and then ulnar deviation, radial deviation, and you can rest. Any pain or discomfort? No crepitation heard, no altered range of motion noticed. Now we hold your arms out again. If you could do flexion with your elbows, extension at the elbows, perfect, and then pronation and supination. Wonderful. Any pain or discomfort?
No.
No crepitation heard, no altered range of motion noticed. And now with your shoulders, if you could bring your arms up like this, external rotation, and then back down, internal rotation. Perfect. Arms down at your side, abduction and adduction. Any pain or discomfort?
No.
Wonderful. And there was no crepitation heard, no altered range of motion. Now I'm going to check your hands for your capillary refill. I see that it was less than 3 seconds, which indicates good peripheral circulation. As well, I'm going to get you to grip my fingers. Perfect. You're going to hold on to them. I'm going to pull away. I want you to hold on, all right? Pull. Perfect. You can let go. Grip is a +5 strength, which is normal for my patient's age. Now, if you'd like to grab a seat. Wonderful. If you could roll your shorts up, I'm going to assess his legs now. So we'll just tilt the camera down. Perfect. Now, upon inspection of the legs, we can see that the color is, it does coincide with his ethnic background. There's no obvious scarring, no lesions, no bumps, lumps, or bruises. And the hair distribution is normal. Now we'll begin palpating his legs. Any pain or discomfort?
No.
Pain or discomfort?
No.
Any pain or discomfort?
No.
Perfect. No pain or discomfort here?
No.
Any pain or discomfort?
No.
Wonderful. Any pain or discomfort?
No.
Perfect. So there is no tenderness in my patient's legs, no pain or discomfort noted, no obvious masses felt. And I'll be testing, again, we'll roll down the gloves a little bit using the dorsal part of our hands to test for his temperature and diaphoresis, noting that his skin is warm and dry. Perfect. And while we're here, we'll now be palpating his posterior tibialis and dorsalis pedis pulses. Beginning with the posterior tibialis, bilaterally and simultaneously. Perfect. 70 beats per minute, 2+ strength, equal and regular rhythm. And then at the dorsalis pedis, 70 beats per minute, 2+ strength, equal and regular in rhythm. And I will also check for capillary refill. less than 3 seconds, indicating good peripheral circulation. Wonderful. You can feel free to stand up. We'll be going through some range of motion. Perfect. If you could just follow my lead, we're going to bend at the hips, flexion, and extension, come back up. Wonderful. Lateral bend one way, perfect. And lateral the other way, wonderful. And rotation one way, and come back, rotation the other way. Perfect. Any pain or discomfort?
No.
And no crepitation heard, no altered range of motion. Wonderful. And now we'll be checking for the knee. Just bring your left leg up and flex your knee, flexion. Bring it back, extension, down. And now we'll same thing with your right leg up, flex your knee, and extension back down. Any pain or discomfort?
No.
Wonderful. And no crepitation heard, no altered range of motion. Now if you could sit down, we're going to be checking dorsiflexion and plantar flexion. So for dorsiflexion, if I could get you to point your toes up to the ceiling, and plantar flexion, point your toes down. Any pain or discomfort?
No.
No crepitation heard, no altered range of motion. Now I'm going to add some resistance, opposition to your dorsiflexion. I want you to resist, all right? Toes up, dorsiflexion, wonderful, and down. And now plantar flexion with opposition, perfect, and down. Strength is good on resistance, which is appropriate for his age. And now before continuing, I doff my soil gloves, perform hand hygiene. And we'll don on new gloves to continue the assessment. Now we'll begin by assessing the posterior thorax. Can I just get you to stand up? Turn around 180 degrees. So on inspection of the posterior thorax, for the purpose of this assessment and to preserve my patient's modesty, we're keeping his top on, but during a clinical setting, the gown would be off. So on assessment, we can see that skin color matches ethnic background. There are no obvious scars, no lesions, no bumps, lumps, or bruises, and there's no excess moisture on the posterior thorax. Upon inspection as well, we can see the anterior to posterior ratio. So anterior posterior to transverse ratio, from transverse to anterior posterior is 1 to 2. Anterior posterior to transverse is a 1 to 2 ratio, which is normal, indicative of no barrel chest. And now we're going on to palpating. You're just going to let me know if there's any pain or tenderness.
No.
Any pain or tenderness?
No.
Any pain or tenderness?
No.
Any pain or tenderness?
No.
Wonderful. There's no pain or tenderness upon palpation of the posterior thorax. We're going to do, and there's no obvious masses felt. And now we'll do symmetrical chest expansion. So I just want you to take a deep breath in, then marking a T10 and out. Perfect. And symmetrical chest expansion was observed on a full inspiratory-expiratory cycle. And finally, we'll test for tactile fremitus. So on my cue, I just need you to say 99, all right? Go.
99.
Perfect. Go.
99.
Wonderful. Go.
99.
And one more.
99.
Wonderful. And no tactile fremitus was heard. Feel free to please grab a seat. We begin auscultating the thorax, the anterior thorax. We're using the diaphragm end of the stethoscope. Perfect. I just need you to look straight ahead. Arms at your sides, please. Wonderful. And you're just going to follow my cues, all right? Just breathe normally, starting with at the trachea pharynx area for bronchial sounds, where bronchial sounds would be heard. And hold your breath. And breathe. Deep breath in, hold, and breathe. And on the other side, testing bilaterally. Deep breath in, hold, breathe. And once more. Breathe, deep breath in, hold, breathe. Perfect. And moving down to the apices of the lungs. Testing bilaterally as we go, following the zigzag pattern. Down to the second intercostal space where bronchiovesicular sounds would be heard on the anterior thorax. Third intercostal space. 4th. And then we would listen laterally for the vesicular sounds. Wonderful. So there were no adventitious airway sounds, no bruit, no crackling, no wheezing was heard. Breath sounds were clear. Something I wouldn't tell my patient, but I noted his breath sounds were about 14 beats per minute, which is in a good range. Now we'll begin auscultating the heart using the diaphragm of the stethoscope. So we'll landmark the second intercostal space using the notch of the neck down to the angle of Louis, and then going to the right sternal border of the second intercostal space is where we'll find the aortic valve. Moving to the second intercostal space on the left sternal border is the pulmonic valve, and at both these points, S2 is heard loudest. Moving to the third intercostal space on the left sternal border is Erb's point, where S1 and S2 are equal. At the fourth intercostal space, we'll have the tricuspid valve, again at the left sternal border. And now moving down to the fifth intercostal space on the midclavicular line is where the mitral valve is located, and this is also known as the apex of the heart. And we'll take note of the apical rate here. The apical rate is about 70 beats per minute, and it is regular in rhythm. And now we'll be using the bell end of the diaphragm, once again, at the same landmarks, to assess for any adventitious heart sounds. Perfect. Once again, landmarking. Look straight ahead for me. Landmarking at the second intercostal space from the notch of the neck down to the angle of Louis. And now on the right sternal border, second intercostal space, we find the aortic valve. On the left sternal border, second intercostal space, pulmonic. Moving down to the third is Erb's point, third intercostal space, Erb's point. Fourth intercostal space, the tricuspid valve. And once again, down at the fifth intercostal space on the midclavicular line is the mitral valve. So S3 and S4 were not heard. There were no murmurs or any other adventitious heart sounds, which is good. And now we'll begin assessment of the abdomen. So if I could just get you to lie down on the bed. Perfect. Are you comfortable showing your abdomen for this assessment?
Yeah.
Wonderful. So we'll drape what isn't necessary. If I could just get you to lift your hips up. Perfect. Just exposing the abdomen. And just keeping your arms at your sides, please. Thank you. And now, just on initial assessment of the abdomen, from the profile point, we can see the contour is round and there is no striae. The color of his abdomen matches his ethnic background. There is even hair distribution, and from the foot of the bed, if you could just raise your head up and look at me, I can see his umbilicus is midline and that his abdomen is symmetrical. Wonderful. We'll begin auscultation of the abdomen first, starting at the right lower quadrant, using the diaphragm of the stethoscope. We'll be moving in a clockwise fashion, listening for vowel sounds, which are active about every 10 seconds with a gargling characteristic. As I hear them, I move from the right lower to the right upper quadrant, and from right upper to left upper, and from left upper to left lower. Wonderful. If I weren't to hear any vowel sounds in a quadrant, I would make sure to wait at least at most 5 minutes before documenting no vowel sounds heard and moving on to the next quadrant. And now we'll just begin light palpation. Just let me know, starting with the right lower quadrant, and just let me know if you feel any pain or tenderness, okay?
Yeah.
Any pain or tenderness?
No.
At the right upper quadrant, any pain or tenderness?
No.
At the left upper quadrant, any pain or tenderness?
No.
And at the left lower quadrant, any pain or tenderness?
No.
And I felt no obvious masses or any edema. And now we'll also palpate the bladder. Any pain or tenderness?
No.
Wonderful. And I felt no distension in the bladder as well. And the this is my physical assessment. Thank you.